Well, I want to thank everybody for coming today. As we know, healthcare is in disarray in this province, and the Buffalo Party has a fantastic plan. Something that we've heard all over the province is that doctors are leaving because of pay. Other provinces pay better. We don't. Buffalo Party is committed to a 20% raise immediately for all doctors and RNs in the province. Rural doctors and RNs, 30% pay raise immediately. This is needed to retain physicians that are currently here and nurses who work in the system, especially long-time experienced people. Also, we've come up with a plan to help everybody that works in healthcare, period. We are going to break up the centralized healthcare and break it back into small community healthcare again. So if you want to work with your local hospital, donate money, make it a better place, you can. It's in the community where you live. We will remove those red tape strings that government's put in place. Also, we will quarterly give a dividend to every member that works in the healthcare authority and in the healthcare system. So what this does is this encourages people to work more effectively in their region because they know they're going to be getting a quarterly bonus. And it doesn't matter if you are an administrative person, if you're home healthcare, you're a CCA, whatever your role is, you will get a percentage of the profit of your section of healthcare, and it will be something that will embolden families that are working in healthcare and maybe contemplating leaving the profession. So I think that Buffalo has a clear plan for the future, a clear plan for retaining people. Lastly, we're going to open up the U of S medical schools to allow more doctors to come in and more nurses. The doctor retention would be solved, could have been solved 15 years ago, if we would have been allowing more Saskatchewan kids into university that want to be doctors. They aren't going to leave the province when they graduate, and they'll stay here. Also, when they come from small towns, when they need a doctor in a small town, they're more likely to stay because they've grown up there. They went to school there, they played sports there, they know everybody, their families are there, they want to come home and help. So this is a simple common sense fix that we have, and the Buffalo Party is proud to bring it forward. Lastly, we know that healthcare has got to become a number one priority. The $100 million of new money that's going to be injected from the North NDP and Sask Party, what they've talked about, is not nearly enough. We need to bring $1 billion in. How are we going to pay for it? We're going to pay for it with increased revenue from oil royalties. It's simple math, and it's a way to get things done. But we got to take care of this now, not in the future. Lastly, we will create a 5-year, 10-year, 20-year, and 100-year plan for healthcare in the province. We are always playing catch up. We're always in crisis mode, and we need to end that as well. If we were running this as a business the way it should be, we would have a plan and we'd stick to that plan.
You mentioned oil royalties. Another party's talking about potash royalties. Would you touch that one too, or what are your thoughts?
Well, I think that royalties should be set as equitable in the resources. So that's something that would probably need to be looked at if all of those industries are essential part of the province and the revenue stream for putting forward programs in the province. Then yeah, we'd have to relook at those.
With oil and potash. Okay.
Correct.
You said a percentage of the profit would be the bonus to the healthcare workers. I thought they just spent money and didn't make money. So I'm curious how you would calculate this.
Well, that's how we're going to be changing this. We're going to change this to a business model as opposed to a cash cow model, right? So what this does is in every department, wherever you work, you'll try and work more cost effectively, more efficiently, because you know that there's a bonus tied to it. And a lot of companies that are operating internationally right now do the same thing. So if everybody performs at a higher level and a more efficient level, everybody benefits from that success. So we're going to change this to a business model where the healthcare is a business and everybody knows that, but it doesn't operate that way. So that's what we're going to do.
You kind of mentioned that like you want to like more Saskatchewan people to actually be in healthcare. Would you rather healthcare be more public than private, like to get those people in?
Well, I think that even right now, there's public and private healthcare going on in the province, right? And I think that at some level, it has to change, right? Because we cannot afford the route that we're going. So when you look at private and public healthcare, nobody's going to get denied healthcare in Saskatchewan. It's never going to happen. But if there's the possibility to speed up wait times and lower wait times for surgeries, MRIs, all the things that have staggering wait times right now. If there's a chance to improve those through private and public healthcare, then I think that's the route we need to go.
Do you think like how long do you think it would take to actually get $1 billion to build in healthcare roughly?
It wouldn't take long because current government has been wasting money all over the world. We start to cancel some of those pet projects. We cancel the Lake Diefenbaker irrigation program. It doesn't take long for us to get $1 billion into the coffers, even without the extra oil revenue royalties that we've been talking about. So it's just it's a matter of, again, running government like a business as opposed to a cash cow where everybody's got their hand out for money.